Welcome to Practical Talk Time. I'm your host, Usha Kumar. Continuing from the discussion that I had last week on healthcare with Lynne Ide from Healthcare Foundation of Connecticut, the Universal Healthcare Foundation of Connecticut. I want to talk about the state of healthcare in Connecticut and what each one of us can do to make things better in terms of the kind of care we get and how much it's going to cost. So please join me in welcoming Lynne Ide. Lynne,
hello, how are you?
Welcome back to the show.
Thank you.
It was such a wonderful discussion we had last week. And most people got an idea of what your foundation is about. But in case some of our audience did not tune in last week, could you quickly tell us about your work and the foundation itself?
Very briefly, I have been an advocate and a lobbyist on a number of issues over the years, starting back in the 1980s. I've worked at several organizations that focus on advocacy, such as the Connecticut Citizen Action Group and the Connecticut Housing Coalition. I've been at the Universal Healthcare Foundation of Connecticut since 2006, and I've been working on healthcare issues on and off since the early 1980s in the state of Connecticut. The Universal Healthcare Foundation of Connecticut is a nonprofit, nonpartisan, philanthropic and advocacy organization that was founded a little over 15 years ago when Anthem Insurance bought Blue Cross Blue Shield of Connecticut. And in that transition of a for-profit company buying a not-for-profit company, the result of a court case that was bought by consumers and advocates created a pot of money set aside for our foundation. And our mission is to really be a catalyst for transformational change in the state of Connecticut, of our healthcare system, to focus on quality, cost, and access.
The Universal Healthcare of Connecticut itself, can it use the help of the citizens to volunteer and tell you what really they want?
Well, absolutely, absolutely. You know, in fact, last week we talked a lot about sort of healthcare policy in the more macro sense.
Yes.
But I think I said in the show last week that the thing about healthcare that's unlike any other thing that you purchase is it's not really a product, a commodity. It's a very personal thing that is supposed to take care of you when you need to be taken care of.
Yeah, that is why people get very sensitive and very upset very easily because of that personal nature. And they feel so helpless and getting very angry now at this point.
Right. And one of the things we find when you talk about the issue of healthcare and what we should do to change our system is that so often the everyday person is left out of the conversation. When you are at your doctor's office or visiting your nurse practitioner or rushed to the hospital for an emergency or dealing with a terrible chronic illness, you're often not in a good place to be the best advocate for yourself. And why should we be advocating for ourselves when we're sick? And why shouldn't we be focusing on a system, creating a system that really focuses on keeping people healthy? And if we do that, we really believe that we can focus a lot more on controlling costs, because really 75% of the costs in our healthcare system are on managing chronic illnesses and preventable incidents of health care, really.
Yeah,
you know.
that leads me to another question, which I was going to ask later, but let me just bring that in here. Most people find that, you know, now that the Obamacare Act or the plan has said that, okay, you get one free preventive care checkup. And what I find is that preventive care checkup is just nothing. They take your height and weight and BP and just a little bit of a blood test, nothing. They really don't check thoroughly. And I'm saying but then if you look at the price they charge for that, It's like as if they checked every little organ in your body.
Well, I
and
think
they shouldn't be, even though the government is paying, or even if it's supposed to be free, they shouldn't be charging that much. So
well, I think what you're,
and it's not a real preventive care.
well, I think there are two things
Yeah.
going on here. One is that we do need to focus on prevention.
Yeah.
And if we can focus on stopping things before they happen,
Yes.
health incidents, keeping a person from developing type 2 diabetes perhaps, or managing a heart issue rather than
Definitely.
waiting
That'll-
until you end up in the hospital.
Yeah, that will
We
bring the cost down,
will
because
bring
that
the
is the
cost
major
down,
cost.
but it also improves the quality of life for the people that are
Yes.
experiencing
Yeah.
it. So there's an issue around quality of care, which we really need to have everyday people working with groups like the Universal Healthcare Foundation of Connecticut to advocate for care that takes care of us, that focuses on wellness and not on sick care.
Yes.
But we also need to acknowledge that we also need to change the public's approach to their health care, because many people don't want to go have their regular.
They avoid going to the doctors.
Right.
They don't want their regular checkups with the doctor.
Right. If
And
you're
then
slightly,
suddenly they go there with a heart attack.
people want to be fixed when they want it, but they don't necessarily. The system is not set up to encourage a good give and take between patient and their healthcare provider, and to allow that to happen, and to focus on helping to keep a person, giving the person the supports that they need to be healthy. So a slapdash visit where the vitals are taken and the person is sent out in 15 minutes isn't going to get to the root of why they've been struggling with something, and they may not be able to deal with it, and they may need some help figuring out how to get that exercise they need, or to lose that 25 pounds that they've been wanting to lose.
Or find out what's basically going wrong slowly.
Right.
You know,
Develop
things
a
always
relationship.
start slowly, and the person may not know, but a good checkup will reveal it, and
Right.
then you can take action at the early stage.
So I think what I want to do is just pull it back a little to the macro just for a second, and say that when we're talking about transformation of our healthcare system, we're focusing not just on getting people access to care, but making sure that that care, that the people providing the care and the people getting the care are working together to focus on health first, and not focus on managing sickness after it happens.
I have a lot of questions. I know one of the questions that we talked about earlier was that there competition amongst providers and competition among the insurance companies. They're all reducing, but then among the insurance companies we have something a little bit better happening in terms of nonprofit insurance companies coming into the scene. But then as far as providers go, there's a lot of consolidation going on, thereby reducing competition. Could you tell us a little bit about that?
There is a lot happening in the healthcare industry right now, some of which is related to the Affordable Care Act, and some of which is just market forces at work. And I think one reason that the foundation, the Universal Healthcare Foundation, is very focused on finding people who would like to get involved is that we need to up the game of healthcare consumers in our state so that they can be more savvy consumers of healthcare, and also work with other folks to hold our healthcare system accountable. And so one of the things that's happening is a good thing from changes in the industry is that Connecticut now has more health insurance entities, nonprofit, Two have come into the market, Hartford Pilgrim and Healthy CT. And so now if you're shopping around, there's a little bit more choice. But then it comes time to go to the doctor or the hospital or the clinic. And what we're seeing, what we're seeing in Connecticut right now is something that's happening in other parts of the state. And I actually encourage people to go to the Universal Healthcare Foundation's website, which is universalhealthct.org. And we just published a report on what's happening in the hospital industry in the state of Connecticut. And there's a lot of easy to look at charts too. But basically, what we're seeing as a result of sort of market-driven forces is that there's consolidation happening in the industry. And there used to be 30, 32 independent hospitals in the state of Connecticut. No, I just want to say there's a question about whether over the long term, over the next generation, do we still need, with a state with just a little over 3 million people, that many different hospitals? And there's a big emphasis on keeping people out of the hospital. So do we need as many hospital beds? That's a question that needs to be looked at. But in the very short term, like right now, what's happening is hospitals are consolidating into bigger networks. So the Danbury Hospital Network, the Hartford Healthcare Network, the Yale New Haven Network. And so what we're left with is a number of hospitals who are now consolidated into these bigger networks. And then there are maybe 7 or 8 hospitals left in the state that are independent. They just formed an alliance called the Value Care Alliance, even though they're all independent. And medical practices are being bought up by these big hospital networks. And so patients in the state of Connecticut are going to have fewer choices and less bargaining power to shop around. And costs, what we find through, if you look at the report on our website, costs go up when consolidation happens. They don't go down. And so the consumer is going to be squeezed by this. And the insurance, people who are paying for insurance, whether they be employers or the state of Connecticut or other places, or the individual, they're all being squeezed.
So our tax money, more of our tax money will be wasted on this.
We spend, over 30 years ago, we spent about 8% of our gross national product on healthcare, and now we spend 18%.
Yeah, I believe that. I thought it would be 3 times, which I thought would be 24%.
So it varies depending on which figures you look. Some are 20%.
Yeah.
So, but we do spend a lot of money on healthcare, and we need to be talking about how do we get back to a system that focuses on the right things and control costs, but not by rationing care, not by telling people they can't have things that they need, but to try to make sure we're focusing on really, do they need the things, all those things, and what's going to make them well.
Lynn, I liked your suggestion that every citizen, if they are not liking the current health care in whatever shape or form, they should be heard and their voices can be heard. And I think they should consolidate and everybody come together so the voices can go as far as making the policies. Because right now the people are left out of the policy making, really. And that's what is affecting us, our lives individually.
And it's very hard. And it's very alienating because our system is so complicated. It's really hard for the average person to figure out, if I wanted to speak up about this, how could I do that? So I do encourage people to go to the Universal Healthcare Foundation of Connecticut's website. And if you click on Get Involved there, you can figure out a way to sign up. I also encourage people to, if you don't want to do that, just to go on and, for example, read our blogs and see if there's something that interests you. Well, we're not taking contributions right now, but we are.
Contribute in terms of ideas and
contribute ideas. Send us an email. Say, I live in such and such a place, and if there's a meeting happening in my part of the state, or you could find out about legislation that's being talked about at the Capitol. For example, next week, there is going to be, well, over the coming months, there will be public hearings at the Capitol on a variety of issues. It's hard to track that yourself. It's easier to track it if you're connected to an organization. And we have tens of thousands of people from around the state. And you will let people know
when the next meeting is held and where?
We're trying to set up a system where we can let people know about the things that they're interested in knowing about.
Yeah, thanks to you. I was going to go to that commission meeting, and the weather was really bad that day. And then I took your suggestion that I could just sit at home and watch it over TV. Live broadcast. That is wonderful on CTN. I watched the whole show. It started a little late. It went on till noon. But I sat there for the 2 hours and watched their entire proceeding. And I must tell you, I was so shocked that the entire time was taken up by these doctors and their little groups telling how much they got $2 billion for getting all the IT and software they needed to get into this Obamacare plan kind of thing. And the thing is, manufacturing industries did that decades ago. When they had to go get internet and make payments and receive payments from their retailers, wholesalers had to change their system, because I worked in finance and accounting, and we had to quickly, within 6 months, within 1 year, we had to get the right software and be on the same platform as the payers and the same platform as the manufacturers, so that we can talk to one another via internet and reduce costs and get paid properly and keep all the costs down. And the companies had to spend their own money to get that software. And look at the medical industry, all the doctors, doctors in the hospitals and everything, they were very slow to switch to the kind of IT that's needed for current day business of any sort. And they kept crying and said, oh, we can't do this, it costs too much. They got the government to pay. Connecticut alone got $2 billion that was given to doctors and healthcare providers. You knew that?
I didn't.
$2 billion they've used out of the tax money for IT. And they used that same IT cost as the excuse for their increased cost. And I'm saying, taxpayers paid that. You can't put that again, double count it as your cost and then again get it back from us in terms of premiums and whatever else. So that I watched that, and then most of the people that were there in the commission, they just sat there and just said, oh, and the doctors, they didn't have to say when they'll do it. Oh, they will get it done when it gets done. There didn't seem to be a deadline that they had to do it quickly. And there were only two representatives. They were both Democrats who even brought up the question of the runaway costs and a little bit of other hard questions. But they only had like less than a minute or 30 seconds to talk. But most of the talking was just about, this money we spent it. We are doing this study. We are doing that study. God knows what. But the entire IT money was spent on that. So for some reason, this industry doesn't have to spend its own money for the software, because the software is a one-time thing, and for a few years they don't have to redo it. But they put it on their regular cost, and they upped all their prices as if they're going to spend that every year by themselves. And even that they didn't spend from their pocket; it was tax money. Another important thing.
Well, can I just respond to that?
Yes.
I just think for the viewers, I'm not sure. I wasn't at that meeting you were talking about. I'm assuming you're talking about the state's healthcare cabinet meeting that you were watching.
The
I don't know what commission you were talking about, but
at
any rate,
the one
it's clearly
supposed to be by Nancy Wyman. A lot of people didn't turn up that day because of the weather.
It was probably the state healthcare cabinet.
Yes.
And I think what Usha's talking about is that for the viewers, that there are ways that you can go on the website for the Access Health CT, our state health insurance exchange, or the state healthcare cabinet, various other public entities, and if you go to CTN, you can get live streaming of those meetings or watch them on your computer at home.
That's the best.
And so that's Connecticut Television Network, which is sort of like the CNN for our state capital.
Yeah, on my Comcast channel, it was channel 20 or something.
Okay.
So in case people
So what
want to know.
Usha's saying is that she watched something, and I can tell you got hot under the collar about it. And if you get hot under the collar about these things, we really need people to be more educated about how all these pieces fit together, so that they can be more effective advocates. If you think it's hard for average, everyday people to understand, it's also hard for our elected leaders to understand all this and how it all fits together.
Exactly.
And they respond when they hear from their constituents. So it is important to get a little educated about this, and one way to do that, I would say, is to follow us through our blog. We blog about a lot of different current healthcare issues, and you may find something that really interests you and say to us, hey, I'd like to get involved in that.
Yeah. There's another thing I wanted to ask. All the manufacturers, again, since I come from manufacturing, accounting, finance background, I know that in the companies that I worked in, we had to quickly install all this, the UPC symbols, where every item would be marked with the cost, or with the code, so that the cost can be determined. Like everybody would know how much it costs. And that again, the companies had to do spending their own money for the IT for that. They had to, and even and I worked for a plumbing products company where even for an item that was $2, we had to put a label saying how much it should cost, right?
Well,
and now the medical industry, there's no cost transparency. It could cost thousands of dollars, but they won't tell you up front how much it'll cost for the various things and how many things are involved, how many bills you'll be getting.
We believe at the foundation that our health system needs to be more transparent and accountable. Accountability is key. Transparency without accountability is not going to be helpful. We particularly think the way some decisions are made and the way policies are made need to be more accountable to the people that are paying for those services. One slight difference between healthcare and many other things that you purchase, though, is that it's not much of your healthcare is not shoppable. You cannot go online and figure out what certain types of treatment at a hospital are going to, at various hospitals in the state, are going to cost. And when it comes time to be rushed to the emergency room, you don't often have a choice about where you're going to go. You're going to go the closest place because it's an emergency.
That's true.
So I don't want to give people a false sense of that if they just had transparency, things would be taken care of.
Well,
because most people are pretty, they're not going to want to or be able to shop around when they're really sick.
That is true.
So what we want to try to do is work on the issue of transparency attached to accountability, particularly for the big networks, the big systems. I mean, I think some of the things that you raised about technology and the medical industry, it's unfair, I think, to probably generalize it to the entire industry. There's a big difference between a small 3-person medical practice and a consolidated hospital network that has 5 or 6 hospitals in its network. And some of those entities are for-profit, some are not for-profit.
We only have 3 minutes left.
Okay, so I think it's very hard to generalize across the industry and just say the industry is taking taxpayers' money and has no accountability. There's a lot more nuance to it.
I do agree to some extent. In fact, the medical industry, because of the situation where people come and it's a health, and when they are suddenly sick, they are going to take care, they should have even more empathy, and they should be even more careful with what they charge. You know, they should take it upon themselves to do. You shouldn't need an advocacy group to come and do that.
Right. Absolutely.
And then I will disagree with some of what you said in the sense, if an ECG with the one machine costs this much here, and it should cost similar amounts in different places. It can't be. There is a big wide difference. There's a national research done.
That takes regulation.
Yeah.
And there are states like Maryland that regulates hospital rates.
Yeah, a mammogram can cost.
We don't do that in Connecticut. That would take some advocacy.
I see. So there are all these questions. There are more questions, but we are ran out of time. One other thing is the medical industry, for some reason, doesn't think there's any money back. If we are not satisfied with whatever service or things that you get. So for some reason, this industry has bucked the trend of what's happening to all other industries, manufacturers or other service providers and other industries.
I have a positive note on that, though, to leave on.
Okay.
The state does have what's called the State Innovation Model.
Okay.
And it is a program that we received competitive grant funding through the Affordable Care Act to focus on changes in the way in which we pay for health care, reimburse for health care, with a focus on accountability and slowing cost over time. And I encourage people to check that out.
Thank you very much. It was a wonderful informational chat with you today. I'm sure our audience got a lot of important information from what you said and from your experience. I'm glad I was picking your brain there. Mm-hmm. Thank you very much, Lynne.
Thank you.
Please, I would like you to come back to the show again, because it looks like we want to talk about the events and also the things that you have been involved in and future projects and events.
Perhaps another time I can do that. Thank you.
Thank you very much. For those of you all watching, I hope you enjoyed the show. If you have questions, please write to practicaltalktime@yahoo.com, and please get involved in this mission so everybody can get access to good quality healthcare at lower costs.